chest feels funny. It's really hard to breathe. I'm gonna call 911.
Her vital signs are 130 over 80. Pulse is running between 110 and 125. How much sooner are we going to be there? We need to get there fast. How many more minutes? Hi there, Miss Snell. I hear that you're having some chest pain. Nurse Rhonda, can you please bring in the EKG machine?
Hi, Miss Snell. I'm Nurse Rhonda.
This is a 34-year-old woman who was here brought in by the ambulance for chest pain, shortness of breath. How long have you had your chest pain for?
It just started when I was sitting on the couch.
And have you ever had this before?
No, I've always been a healthy person. I usually run 3 miles.
Do you have any cardiac disease in your family? No? Okay, so we're going to do this test. We're going to get some lab work. We're going to do a white blood cell count to see what your what's going on with your white blood cells, your red blood cells. We're going to do electrolyte panel, which is called a BMP. Check that out, see what else is going on. We're going to hook you up to this monitor here, and Nurse Ron is going to come back in a little bit and start an IV on you. Okay, good to go. So her echocardiogram was quite interesting. It showed she had a low ejection fraction of 25%, and she did show that she has some ventricle, right and left ventricle damage, and shows some ischemia there. So I think we need to go in and do a biopsy and see what's going on because of her high eosinophils and high white blood cells.
Okay.
Okay?
Hi, Miss Snell. How you doing?
Good.
Well, I was talking with your doctor, Dr. Sagmiller, and we went over the results of your echocardiogram and the biopsy that we had done. And it looks like you have a rare form of heart failure called eosinophilic heart failure.
What is that?
It is actually a very rare disease where your eosinophils, which is a white blood cell that is made in your bone marrow, and what they do is protect your immune system. But sometimes they all of a sudden will start to just multiply and multiply and multiply. And usually this comes from a reaction to a medication, or sometimes if you have an autoimmune disease, that can trigger as well. It's very unknown. It's not a very common thing. There's not a lot known about it. So what happens is these eosinophils migrate to your heart, and it causes inflammation of your coronary arteries, and then eventually it causes these coronary arteries to start closing up, and that's what causes the pain because your heart is not getting the blood that it needs to get. Do you understand now a little bit?
Mm-hmm.
Okay. So I'm going to go talk with the doctor about how we're going to treat this, and then we'll come back and get that started right away. The good thing about eosinophilic heart failure is it usually is very treatable, and people recover quickly and fast as long as they do what they're told. Okay?
Okay.
Okay.
Okay, Miss Snell, I just wanted to talk to you about some of the results and the treatments of what we're going to do for you. So we did the echocardiogram and the angiogram and the biopsy, which all show the, eosinophilic heart disease. And for that, we usually start with treatment of steroids because that's the easiest way to do it. And then we'll recheck your labs, and if it's working, it'll show that your white blood cells are going down and your eosinophils are going down, and you'll start to feel better. If for some reason that prednisone doesn't work, we might try another steroid, but if nothing seems to be working, we will, worst case scenario, have to go in and possibly do a bypass or take an even deeper look in there, and sometimes worst case is a heart transplant. But we're crossing our fingers that this prednisone is going to work, okay?
Okay.
Hello, Miss Snell. I'm so glad that the prednisone worked. I just wanted to go over your discharge instructions before you get to go home. Okay? So our nursing diagnosis for you was decreased cardio output related to alteration in heart rhythm as evidenced by the symptoms that you came in with, the chest pain, the fatigue, you were tired and having a hard time breathing, right? So what we did for that was the tests, and we watched your labs closely while you were here in the hospital. We also recorded your intake and output to make sure you weren't retaining any water, and then we administered your prescriptions, the prednisone, as needed. So our goals were to keep your pulse between 60 and 100, which is what we have managed to do, and we've kept your breathing down again between 12 and 20. That was our other goal. And then we also wanted to make sure your stamina came back and you weren't feeling that weakness. Do you feel like all of those goals were accomplished?
Mm-hmm.
Good. So like what I would like you to watch for when you go home, like the same symptoms that this could come back. You want to watch for the chest pain and the breathing, the hard time breathing and feeling tired. If any of those things happen again, then you need to come back in right away so we can do the treatment again. Also, you need to make sure you have your blood levels drawn twice a year to check that those eosinophils. It takes about 6 months for them to build up to the level where you're at, a few days ago when you came into us, okay? So 2 times a year, you need to go in and have your CBC drawn. Super easy, just takes a couple minutes. And then just watch for those symptoms, okay?
Okay.
Okay, we're so glad that you're all better. Woo!
Cheers to the freaking weekend. Cheers to the freaking weekend.